Yeah, so dementia, what is dementia? Dementia is the underlying syndrome beneath the Alzheimer's. And dementia is, actually, it is defined as a progressive impairment in intellect and cognitive function. And it is actually, before I talk about the types, I want to talk more about the clinical criteria. There is a manual in the United States called the DSM manual. It is used to classify and code psychiatric illness. And in that manual, they classified, they defined dementia of any type as a progressive impairment in cognitive function associated with at least one more symptom of cognitive function, which include aphasia. Aphasia is, simplified, as language disturbance. A person cannot express himself. Or apraxia, which is inability to carry out motor activity despite intact motor function. For example, person cannot stand up or sit well because of this problem. Also disturbance in executive functioning. What I mean by that is that the person with Alzheimer cannot organize or plan his life or his, plan his lifestyle. So these are actually the symptoms that can present, but the main symptom, as I mentioned, is memory impairment. Now, if we want to talk about the types of dementia, the most common type is the Alzheimer's disease, which we'll be talking about today. Other types, common types, is vascular dementia due to vascular damage. Other cause of dementia can include substance abuse, for example, alcohol. There's something called alcoholic dementia, which is caused by chronic use of alcohol. Other causes include, which are less frequent, are infections. For example, where there is the HIV virus or the syphilis can cause dementia. And then there are some reversible causes of dementia, which means that can be corrected medically. For example, metabolic abnormalities like hypothyroidism, in which the thyroid hormone is decreased, can cause dementia, as well as deficiency of certain vitamins like vitamin B12 and folate.
Okay, Dr. Mohammed, what about the age that be affected by Alzheimer? Especially we know that it's 50 or 55 or something like this. What is the difference between if it be affected by person in 26, 27 or 30? What is the difference between them, and what is the special age that be affected by Alzheimer?
Yes, Alzheimer is typically the disease of the old age and the aging. It's very rarely below 65, although Alois Alzheimer did describe a syndrome in a 50,
so it began
but
from
usually
65?
from 65, yes. Usually above 65.
Not less than this?
No, it can happen still. It can happen, and it is called early dementia. But typically, I mean,
from what age?
You mean
the less age?
It can start from 50, and of course depends on the cause. Some causes can even start before that, but usually it starts on the older age, around 50, 55. This is called early, but usually 65, 65 years of age. And because there's a study of the prevalence of it in the general population, they found around 5% of people above 65 years of age might develop dementia.
Yeah. Okay, what is the difference, I ask before, when it comes in 27 or 26 or 30 and 65?
Between 65 and what, sorry?
Or 30, 20, in the youth, the age of youth.
Usually the difference is, again...
It can be occasionally, or it be as a disorder in his life. Yeah.
To be very clear, Alzheimer's rarely, extremely rare in the young. So you might never see a patient at 35 with Alzheimer's. They might have other types of dementia, like vascular, due to a vascular injury in the brain. They might have it, but otherwise, in the young age, they usually don't have Alzheimer's. It's mainly like 50, 55, 65. And if you differentiate between an early dementia and a late dementia,
in the youth rarely.
Yeah.
So the result in the youth rarely.
Yes, it's very rare, extremely rare actually.
What about the children, doctor?
No, children, they don't develop dementia. It cannot be reported, it cannot be seen in children.
What kind of forgetting that it can be affected by them? That I know a child in the home, and he forget what room he want to go. So it kind of Alzheimer or not?
No.
And he was treated by a psychiatrist.
Yes, of course, memory...
10 years, I think.
10 years.
Yeah.
Well, memory problems or memory impairment are not only included in dementia or Alzheimer or the other...
It's kind of forgetting, but it's not
just a symptom of Alzheimer, but memory impairment can be a symptom of other psychiatric condition or mental illnesses, or maybe even organic illnesses. This child might have some sort of anxiety or depression, which can be associated with a memory impairment or forgetfulness.
Yeah, something relates him to this?
Yes, probably he might have an anxiety. If we search more in this child about what the symptoms he has, we might find that
What
he...
kind of an anxiety that it can be in a child have 10 years old only?
Actually, children are very prone to anxiety, and one of the most common disorders in children, a psychiatric disorder well known to us in the DSM, as I mentioned, the DSM, the manual, is a separation and anxiety disorder, in which a child develops anxiety when he's separated from his parents or from his home. This is one of the disorders, but children are prone to any type of anxiety. For example, even generalized anxiety disorder is also well known. So these types of anxiety can cause the child to have memory impairment and forgetfulness.
Yeah, okay, Dr. Mohammed, we'll complete our discussion about Alzheimer, about child, youth, adults, and the overage. But after this short report, we will continue our discussion immediately, inshallah. Let's see.
The genetics of Alzheimer's. Can you inherit Alzheimer's? Is it in your DNA? What role does genetics play in this mysterious and terrifying disease? These are difficult questions with less than perfect answers. Like everything connected to our bodies and minds, Alzheimer's does have a genetic component. Genes do play an important role, but that does not mean that genes actually cause the disease. Only a handful of families carry one of the 3 rare genetic mutations that will guarantee the onset of Alzheimer's. These mutations account for only 2 to 3% of Alzheimer's cases. It is highly unlikely that you are in this group. The rest of us face more uncertain risks associated with dozens of other genes, some of them already known, others not yet identified. Unfortunately, as far as we can tell, no person carries a genetic immunity to the disease. That's because genes rarely cause traits or diseases directly. Instead of dictating a predetermined outcome, genes interact with our bodies and environments. The foods we eat, the air we breathe, even our feelings and moods. Genes are like switches that get turned on and off all the time. This unpredictable interaction is part of what makes us so different from one another. Nature and nurture turn out to be inseparably intertwined. In recent years, scientists have identified several specific genes that seem to either increase or decrease people's risk of getting Alzheimer's disease. The next step for these researchers is to identify the rest of the relevant genes and then try to figure out what external factors turn them on and start the disease process. Then they can try to develop drugs that interfere with that process. This is not the only avenue for drug development. There are others, but sorting out the genetics may well play a pivotal role in stopping the disease. What about getting tested for these so-called Alzheimer's genes? As of now, there's no practical benefit. The results won't reveal an immunity, nor will they tell you that Alzheimer's is likely in your future. The hard truth is, we all face the risk of Alzheimer's as we grow older. And no matter what your genetic profile, the best way to lower that risk is the same. Eat a heart-healthy diet, try to reduce stress, and regularly exercise your body and your mind.
Welcome back, our viewers. Ensuring the screen, I think, very important report. We know more about the symptoms and the causes, but let's ask Dr. Mohammed about the causes of Alzheimer.
Yes, the causes of Alzheimer, until now, generally speaking, the exact causes are unknown. However, there are several competing hypotheses trying to explain why Alzheimer happens. One of the oldest theories or hypotheses about the cause of Alzheimer is something called the cholinesterase theory. What does that mean? It means that there is a neurotransmitter in our brain called acetylcholine. And it has been found that patients with Alzheimer's have a reduced synthesis of this neurotransmitter. And because of this reduction in the synthesis, the concentration of acetylcholine in the brain becomes less, and so people might develop Alzheimer. Of course, this theory or hypothesis has not maintained a widespread approval or support from scientists, because the medication that correct this problem hasn't shown much effectiveness as people might have hoped. Other causes involve something called the amyloid deposits. They found that amyloid deposits, plaques, and tangles are found in the brain and in patients with Alzheimer's.
Dr. Hart, please, we want to simplify this expression.
Yeah, I mean, yeah,
this
is a bit, it is, yeah, a bit too much deep, but so I mean, the problem, they most likely found that there are some, you know, like when examining the brain of people with Alzheimer, they found certain changes and deposits in them. I was just trying to name the names of these deposits, but that's what they found. Another theory about the cause of Alzheimer is genetics, and they found there's certain studies found that people with Alzheimer's disease have around 40% chances of having a family history of Alzheimer. So it seems that there is some sort of genetic connection in Alzheimer, which is really still unclear and under investigation. So these are basically the major hypothesis for, or the main hypothesis for the cause of Alzheimer.
Okay, Dr. Mohammed, what kind of person that comes to you as a psychiatrist and be treated from Alzheimer? What kind of the personality inside them? What about the feeling, the emotions, the conceptions, the understanding, the ideas inside their mind? It is different from us or not?
They definitely, when they present to us, they seem a bit different, because Alzheimer's affect them and affect their life to a very strong degree. So they become, most of them are associated with some sort of denial that they have the problem, as I mentioned earlier. They try to conceal or hide it. And also some of them have an anxiety and depression as well. They develop it. They found that some studies found around that 40 to 50% of patients with Alzheimer also develop depression and anxiety. So they feel sad and empty, and some of them are anxious because they are frightened by what they have. I mean, it's a change in their life. They're starting to forget. So they feel anxious. Things are changing in my life. I am changing. Why am I not as effective and as functioning as before? So they become anxious, they become depressed, and sometimes apathetic. Apathetic means they seem emotionless or cold, to simplify it. Others, on the other hand, might, as I mentioned, you know, the Alzheimer affect their emotions and personality, and they appear as if their personality have changed from becoming a quiet person, a calm, quiet person, to more of a joker and a sarcastic person, or sometimes irritable, shouting inappropriately. So it does change the personality of some of the patients who have it.
Well, in the Alzheimer's disease, it is related to organic disorder or psychiatric disorder?
No, Alzheimer's disease is predominantly or mainly is a organic disease. It affects the brain, and there's, as you can say, to simplify it, like reduced neurons, or the cells in the brain are reduced, so the person cannot really function.
But it can be affected by his
yeah, but they can, manifest in psychiatric symptoms. So they might seem as if they have psychiatric illness, but the organic cause is the main reason that they manifest that way.
Okay, some people we know, Dr. Mohammed, when they are affected by the Alzheimer's, they say, okay, I know some people, okay, they are accepted the conception, and okay, we are 65 or 70, why not? We are, okay, big in age, and we are accepted the idea, and they live their life. What kind of people are?
The one they accept the
conception, and they live their life. Their daughters or sons help them, and it's okay.
Most, you know, I think a very important factor in dealing with Alzheimer is the support that you have, the family support. Most likely these patients have a very strong and firm family support from their relatives, like from their kids or their brothers and sisters, that, you know...
Means they are not knowing that they have the Alzheimer, but they think that it's kind of forgetting or something like this according to the age.
Of course, yeah, there's one thing we have to understand first, to differentiate between Alzheimer and the normal aging process. Because most of us, when we grow up, we might develop some level of memory impairment, but it is usually mild and does not affect our function. So this is normal and a part of the normal aging. We shouldn't be worried about, and a lot of old people might have that. So these people have no problem. But if it, it changes into dementia, and the memory starts to become progressive, meaning that becomes worsened by time, then we know that there's a problem and it's Alzheimer's. So people might start become worried when that level starts to progress. And other symptoms might appear as well, like the personality changes, like the mood symptoms, and like the behavior symptoms.
When it affected a person have 65 or 60 or 70, it can be developed after this to a very bad levels or not?
That's a very good question, because there are studies, ongoing studies right now, about the prevalence of, as I mentioned, about prevalence of Alzheimer's disease. Prevalence means how much of the disease is found in the population. And as we mentioned, it is 5% above 65 years of age. However, they found that the risk for developing Alzheimer rises with increased age. And one study found that the population above 85 have a risk of 20 to 40%. So it was 5% in above 65, but almost tripled to 20 or quadrupled.
Very
which
high
means,
percent.
yeah, 4 times. So as you increase with age, the risk for developing it increases or rises.
What about the percent in Saudi Arabia about Alzheimer, that the persons that be affected by Alzheimer? What is about the percent of it?
I'm not really sure if there is any studies here in Saudi Arabia. There might be, but I didn't look it up. I don't really know how much the prevalence is it here in Saudi Arabia, but we do see a lot of Alzheimer patients in the clinic, a very high number of patients in our clinic, in psychiatric clinic, and I'm sure the neurology clinic as well, they might have also exposure to people with Alzheimer dementia, because Alzheimer is conjoined illness between psychiatry and neurology. Both specialists can see a patient with Alzheimer.
You mentioned, Dr. Mohammed, before that Alzheimer's disease can be affected by also an anxiety disorder. Why an anxiety disorder? Because also that 65, he has no responsibility, the age of work is okay, finished, the daughters or sons be okay, have the responsibility and independence in their life. What kind of an anxiety does they have?
As I mentioned, that the studies found that around 40% of Alzheimer's have an anxiety, and the reason, I think, in my opinion, is that when you have an illness, a chronic illness, it will affect you. It's a stressor to you. So when the old age find themselves not functioning like before, the level of functioning, when you are younger, you're going, you're moving, you're energetic. But when you suddenly start to go backwards, you're starting to forget something, you start to have difficulty in movements, your mood will change. So you'll feel shocked, you feel like frightened, because what's going on to me now? Is something bad gonna happen to me? Am I aging now? So I think it's frightening, and this is where the major problem arises. But I think there's also some organic changes in the brain as well that can contribute to the development of an anxiety, which is really unclear. So not just Alzheimer as a stressor, but maybe there is some other hidden organic changes in the brain that might lead to an anxiety.
Really, Dr. Mohammed, very valuable information about Alzheimer. So let's see this short report and we'll come back, inshallah. Let's see.
stand still as you take your last step into the light. Another velvet morning for me, and now I'm trying to tell you about my life. My song is twisted, man, more dead than alive. My feelings live always been betrayed, and now it's falling ill damaged, man. Look what they made. I said, don't you mind that it's lonely? The corridor you walk there alone, and life is a game you try, and life is a game you try. I'm coming down. Your beauty, our colors surround into the light. Another velvet morning for me, and now I'm trying to tell you about my life. My song is twisted, man, more dead than alive. And my feelings, they've been betrayed. Now it's falling ill damaged, man. Look what they made. He said, don't you mind that it's lonely? The corridors you walk there alone, and life is a game you try, and life is a game you try, life is a game you try.
Welcome back, our viewers, and sharing a screen, I think, very important report to all the doctors in the world about Alzheimer. So let's speak to Dr. Mohammed about what kind of change that be affected by the persons that be affected by the Alzheimer, that what is the different actions and the different conceptions and ideas in the personality before and after Alzheimer.
Yes, regarding the personality changes, as you mentioned earlier, that patients with Alzheimer do develop changes in the personality. Now, before the Alzheimer, they usually they have their normal personality, whatever it is, either a calm, a quiet personality or a sarcastic personality. It is what it is before the Alzheimer. Now, after Alzheimer, some of them or a portion of them might have a change in their personality. In what way? They change, for example, in the way they think. In their emotions, for example, they have flexibility of emotions, and their emotions shifts quickly within the day from being sad to happy to crying inappropriately for no apparent reason or laughing inappropriately. They become sarcastic, they become irritable, easily provoked, usually to anger, and in certain conditions they might become aggressive actually, even aggressive verbally or even physically. They might aggressive toward their family.
Dr. Mohammed, you speak about Alzheimer today, and if we have a person in our family have Alzheimer disease, how we can deal with him and how make it more flexible and easy to continue his life?
Yes, that's a very important question, because there's no doubt that the role of the family of patients with Alzheimer is very, very important. And the first step in the family, for the family, is the family education about the illness. The family should have good knowledge and information about the disease, how it occurs, how it presents, or the symptoms and signs of it, and how to deal with it. So if they have knowledge that their family or their relative have Alzheimer, then that's very good, and I think it's the first step and a very important step. The second step for the family in how to deal with a person with Alzheimer is to give support, of course. Be supportive for the family member, be around him, and then use certain techniques that can help. For example, one of these techniques is called reality orientation. What does that mean? It means that the family member should continuously present information to the patient about its surrounding, about the time, about the person, and about the place. So the patient, when he has these information, he can become familiar with his surroundings and doesn't become lost or confused. So we minimize the confusion with these reality orientation. Other steps that they can take, the family, is a modification of the surrounding environment of the patient and the lifestyle, which might help to reduce the actually to help in the patient's safety and to reduce the burden for the family or the caregiver. What do I mean by modification of the environment? Certain changes, for example, adherence to simplified routines, meaning that giving the patient certain recreational activities every day that is simple, not complicated to complicate things for him, just simple activities that helps him orient to the surroundings. Also, at certain points, we might have to place locks in certain doors, especially the ones that takes to the outside, because at certain points the patient might become confused and leave the house, which is very dangerous, of course. So placing locks where they should be is an important thing to do. Then there's also what is called the labeling of the household items, meaning sometimes put labels for everything around the patient, so he knows what is this, where he's from, even labeling the rooms so he doesn't get lost. All these things might help effectively in controlling the patient with Alzheimer. Other things that, because the Alzheimer is a progressive illness, it might become worse and worse by time. One of the things that might happen by time is the patient might develop difficulty in swallowing in the later stages. So the family should help in creating soft meals or cutting the meals into small pieces to help the patient eat. And in extreme cases, sometimes you might have to use the feeding tubes. Another important factor for the patient of Alzheimer is to look out for any other complications that arise, medical complication. For example, pressure ulcers. You know, when the patient all the time is in the bed, he might develop pressure ulcers, so family have to look for that. The hygiene. Also, if there are look for respiratory, skin, or even eye infections. All these factors are important, and the family should look out for it, and careful management might help to prevent these illnesses. And if they do occur, special referral to the specialist or the medical specialist to help manage these symptoms.
All our viewers, Dr. Mohammed, not 60 or 65 or 70, but with also 20 or 30 or 35, something like this. Okay, how we can give them an advice to avoid being affected by Alzheimer after this?
Yes. Again, very important, because our topic today, I'm sure, is creating an anxiety in the viewers now that they're going to develop Alzheimer.
Especially I am.
So, yeah, there are certain, of course, there are several studies going on to try to find either treatment, which we'll talk about later, or methods that we can do in our, youth or younger age that might help to prevent Alzheimer's disease.
It can be prevented, really?
The risk to develop it can be reduced, which might, you know, some might say this, it is a prevention, some sort of prevention. So it can be reduced. We saw also one of the videos talked about ways to prevent the Alzheimer. Of course, one of the most important things is to exercise. Exercise the body and exercise the mind, both ways. Exercise has been found that exercising the body, of course, has been found to reduce the risk of Alzheimer. And also exercising the mind. And how do we exercise the mind? Usually by doing what is called brain activities. Like, for example, it has been found like, you know, like games that help stimulate the brain. For example, the chess game. It was noticed that thinking, exactly. So any exercise that involves thinking, like the chess. Also, they mentioned that people who learn new languages can help in reducing the Alzheimer, because as you mentioned, when you think, you exercise your brain, so you reduce the ability that your cells might, you know, lack energy or start to break down. So these are very important. Also, certain types of food that are rich in vitamins can also help in reducing. Some researchers have found that certain types of healthy food can help, you know, to reduce the risk for
Give as an example about the healthy food.
Well, usually foods that are rich in vitamins, like for the nuts or the almonds, all these have vitamins. Fish, fish is rich in omega-3. I think also omega-3 can be helpful in some extent, but mainly the vitamins that that I know and that are found in also fruits, in vegetables, and also in the nuts.
Yeah. What kind of fruits, doctor?
You know, we have the kiwi. The kiwi has, I think, and then there's also, you know,
it have omega-3.
Sorry?
It had omega-3.
Yes,
kiwi.
it has omega-3.
And this
and the
reduces
fish.
Alzheimer.
It can. I mean, I didn't see a study that. I think it helps in reducing the risk, because, you know, these nutrients are important to help to reduce the risk for, you know, memory.
Okay, what about sport?
Yes, sports is, as I mentioned, the exercise, the body exercise is very important to, you know, reduce the risk, and including sports like swimming, playing soccer, but not injuring yourself, of course. Safe sport, please. So all these can help, jogging and running, maybe lifting light weights also. All these can help to prevent, to some extent, or reduce the risk of developing Alzheimer's.
We'll speak about medication and its safety or not, and about many types and how we can be treated if we have Alzheimer. But after this short report, and we'll come back. Let's see. Welcome back, our viewers and sharing screen. We today speak about Alzheimer disease with Dr. Mohammed Bardi, psychiatry consultant. Welcome for the second time in sharing screen. And we speak today about Alzheimer, the symptoms, the causes, and about how to reduce the risk of Alzheimer by nutrition, sport, move thinking, to make exercises in the body and the brain. Many things, really, many valuable information from Dr. Mohammed. Today we'll speak also about the treatment. Let's ask Dr. Mohammed about how we can be treated from Alzheimer disease and is it safety or not?
Yes, regarding the treatment now, unfortunately until today there is no clear or no definite treatment for Alzheimer, meaning there is no treatment that reverses the progression or cure it. However, there are treatments that might help control the symptoms of Alzheimer's disease. By control, I mean, you know, controlling the behavior, the mood, or even the progression of the memory impairment. So there are available. Now the first class I'd like to talk about of the medication that are available and approved for Alzheimer by the regulatory agencies like the US FDA, the Food and Drug Administration, are called the cholinesterase inhibitors. I don't want to go into details because I know it might be confusing, but what they do is that they increase the concentration of the neurotransmitter we spoke about earlier in the brain, making it more available in the, or reduce the breakdown of it, meaning it to reduce the breakdown of certain cells. They are actually neurotransmitters, but I want to simplify it to the viewers as cells.
Of course.
These medication include something called donepezil, rivastigmine, which is called Exelon. It's available in as oral and also patches, because you know sometimes they can't take oral, you can put it as patch. Galantamine, and there's a new one called memantine. All these medication can be used as on daily basis, and usually approved in the mild to moderate Alzheimer type, and not the so severe. Although memantine is there are reports that can be helpful in the moderate to severe. But usually in the mild to moderate form. What they do is that they help in reducing the progression of the speed of the progression or deterioration. Because I mentioned, you know, it's a chronic illness and it's progressive. It will become worse with time. There's no way to reverse it.
Not for treatment.
No treatment.
Reduced.
No cure, but to reduce the speed. So instead of, you know, going from, you know, mild to severe memory impairment in 3-4 years, to make it longer, 7-8 years. So these somewhat is good. Some
to make it slowly only.
To make it slowly, yes. Other reports found that it can control to some extent the behavior. As I mentioned, they might become violent or sarcastic or, you know, difficult to control. So some reports. But for the behavior, we use another type of class of medication, which are the antipsychotic. Studies have found, and even clinical observation, we found that small doses of antipsychotics can help control the behavior to very significant extent. So the patient, instead of becoming aggressive towards the family, the antipsychotic can reduce this aggression or violence, and the patient, they become more quieter and calmer. Because maybe you didn't mention something in the symptoms. Around 20 to 30% they might develop psychotic symptoms. What I mean by psychotic symptoms are delusions and hallucinations. Hallucinations meaning they imagine things, they hear voices, they see things that are not there.
A kind of OCD disorder?
OCD? No, OCD is a disturbance in thought. This is a disturbance in perception, in the hallucinations. Their perception, they see things that they are not there, or hear voices that they are not there. It's a product of their own mind.
Imagination.
But for them, it is so clear that it's real.
According to the age or what?
It doesn't, there's no relation to age. If you have Alzheimer, you might develop it, 20 to 30% might develop it regardless of their age. But we're talking about Alzheimer, so most likely above 65. But you know, psychotic symptoms can appear in other illness, like schizophrenia and bipolar, which can happen in a very young age, 20, 30, but this is a different topic. So also they might develop delusions. Delusions is a false belief. They believe something so strongly which is false. For example, they think that their family are against them and they are stealing their stuff, and sometimes they think that their family might hurt them or even kill them. It's a false belief that, you know, generated by you know, the complications in the brain.
What kind of disorders is?
This is a symptom. It's called delusion. It's called delusion. And it's called, in this particular type, it's called paranoid delusion. You know the paranoia, when you feel like someone is behind you or someone is trying to hurt you. It's a paranoia, type of a paranoia. So it's a paranoid delusion. It's a false belief.
To be afraid from
afraid,
anything.
they get afraid that, you know, someone might hurt them, the family, the housemaid is going to kill her or something, or kill him. They get really frightened, and then they even act on it. So maybe they'll fight their family, they'll hit them because they're afraid. So in this case, the antipsychotic will help very much to control these symptoms. These symptoms might disappear, or at least reduce to very significant extent, and the patient can live, become quieter and calmer with these medications.
The patient that be affected by the Alzheimer are accepted the consumption of medication or not?
The difficulty with the patient with Alzheimer, they don't accept anything. They find it, you know, they, as we mentioned, there's denial usually, and sometimes they didn't even have awareness that they have a problem. They think, I don't have a problem, why do you give me medication? It's,
or they forget taking the medicine.
Forget, that's why the family support is very important. Most, when we see patients with dementia, usually with their family, it has to be with the family, and the family usually are the ones that provide the medication, even might give it by hand. Because as we mentioned in how to deal with them, you might have to help them with the meals, and so we have to help them with the medication.
Okay.
Also, if you want to talk about another class of medication, do we have time?
Yes.
As we mentioned, that they might have depression or an anxiety as well. In this case, again, we have to interfere as psychiatrist and give them an antidepressant or anti-anxiety. Also, tablets available. There are many types or classes of antidepressant, but of course, in the old age, you have to give them, usually half the regular age for the others because, they are old age, they have complications. You don't want to give them medication that, cause more problems. So usually the dose is very low for all types, antipsychotic, antidepressant, and anti-anxiety. And we have to give it because we have to control the mood, because depression might worsen the prognosis of Alzheimer or dementia.
Okay, we will know more.
The prognosis of Alzheimer or dementia.
Okay, we will know more about Alzheimer and about the treatment after this report, and we will come back to more. Welcome back, our viewers, enjoying exploring. Today we speak about Alzheimer, as I mentioned before, and today we speak about the final end of our program about the treatment. And I will ask Dr. Mohammed about does brain imaging like CT scan and MRI help in the diagnosis of Alzheimer or not?
Yes, well, to diagnose Alzheimer's disease or dementia of Alzheimer type, usually we depend largely on the clinical observation and the history taken from the patient and from the family. So it means it usually is diagnosed clinically. However, brain imaging can help a lot in excluding other causes of dementia or help in certain types of people. Some findings might appear in the CT scan or MRI, but there are other brain imaging, newer brain imaging that measures the metabolism of the brain have been helpful to help in confirm the diagnosis, like something called the SPECT scan and the PET scan. These are new brain imaging, very brand new and more improved than CT scan, MRI, that help in confirming the diagnosis. Now, usually even as psychiatrists and psychologists or neuropsychologists, we use something called the questionnaires. One of the most common ones is called the mini mental state examination. It is a questionnaire of 30 points. We take the questionnaire and then we tick for it to measure the level of cognitive deficits in the patient. And it is very helpful also in confirming the diagnosis of Alzheimer. But the final diagnosis, the real and definite diagnosis, usually is done through neuropathology, meaning unfortunately after the patient dies, when you dissect the brain, you might see the findings clearly. But the brain imaging can aid and help to some extent in the diagnosis. But usually we diagnose it in the clinical setting by the history and the information we take from the family and the patient.
We speak before, doctor, about the treatment and how the family can support the patients that have Alzheimer's disease. From your point of view, what is the role of the family? How we can give them support?
Yeah, as I mentioned, the support is very important without a doubt, and the support is one of the most issues being patient, because the patient's going to be irritable, agitated, he might insult the family, so the family has to be patient and understand that the patient really doesn't mean it from the inside or doesn't understand what's going on.
Yeah.
So being patient is a very important part. Also starting to transform and cope and understand that you are becoming now a caregiver to the patient. You will be responsible about everything in the patient, because as the illness progresses, you'll become worse. You will not take care of his hygiene, his food, so
Everything.
you will be a caregiver. You will have
As
to
a baby.
yes,
He is like that
what about
baby.
hygiene, about food, like as you mentioned, to some extent like a baby, especially when it starts to worsen more and more.
Yeah.
So realizing this sometimes is a shock for the family. Feel like I'm going to do all this.
Yeah.
So they have to understand that. It's a very important part.
Dr. Muhammad, you speak about the Alzheimer, but what about the youth people that have something of forgetting, that they put the object in somewhere and they forget where they, it's kind of the Alzheimer that's in the future he will have, of course, the Alzheimer or not?
No, not necessarily. Of course, as I mentioned earlier, that the memory impairment can manifest or can present in other psychiatric illnesses or even organic. And one of the most common psychiatric symptoms that people might have memory impairment is depression and anxiety. And as far as I know, there is no relation between having early memory impairment due to another cause and Alzheimer.
Yeah.
So I don't think there is a connection between them. But if a person has that, he has to seek for help, because he might have another underlying cause which can be
Not to be
reversible,
developing.
and can be treated.
Okay, but what about your advice to them in homes without any external help to help themselves by themselves? And if they have to go a clinic, what they can do and what is the symptoms if that appear, so you have and you should go to a clinic?
Of course, if it is only a mild memory impairment, it could be due to stress. And in this case, I would advise someone to use a notebook to note what is everything, what a notebook that manages his day events.
Yeah.
This way he won't forget the most important things by this note. This usually is helpful to reduce forgetfulness to some extent. Otherwise, if there are memory impairment, also a person should seek help, or at least check with himself. Does he
Reduce,
have
doctor, or confirm that this person has kind of forgetting. It's kind of confirmation, or it reduce his case.
You mean the forgetfulness?
Some people refuse to write in a notebook something
Yes,
like this because
yes.
it's a confess that he have something wrong.
Yeah.
And he say, no, I will depend on my mind, and I will don't forget again. But it's reduced. Really, it's reduced.
It might help. I mean, this is a help. It will not fix the
Make it
problem.
stop.
It will not help the problem. It will not, I mean, fix the problem, but it will help him at least, gain some confidence when he writes and doesn't forget things. But the most important thing is finding the cause of this. Why does it happen, to fix it? I'm talking about very mild memory impairment. You can use a notebook. But if it is more than mild, like becoming mild or moderate, or in a daily basis, that is making the patient or the person in a problem, he has to check for other causes. For example, anxiety or stress. Just regular social stress or financial stress can be, because your attention concentration is not there when you are stressed. And so you don't register where are things. So when you try to recall them, you cannot remember them.
Yeah.
So in this, the stress is the major problem here, and he has to seek for help to find what's the cause, whether it's stress or another psychiatric
To
illness.
medication,
Yes.
to take the medication and solve the other problem.
Exactly. Or anxiety or depression has to be treated. So, and then once the depression, anxiety is treated, then the memory impairment will go away.
Inshallah,
Spontaneously,
inshallah.
inshallah.
Allah yahfazna from
Inshallah.
anxiety, OCD disorders, Alzheimer's disease, many disorders. Let's see this report and we'll come back. Let's see.
Please don't let the lights go down. Please don't make the night confound me again. I just want to stand up, just want to be heard. Please grant me this one request. don't make me spend the rest of my life watching from the sidelines, left out in the cold. Don't let me fade away, 'cause I still got some things to say. And I know that some people say it doesn't matter anyway. Hey, yeah, don't let me fade away. Please don't let the lights go down. Please don't make the night confound me again.
100 million Americans will be touched by Alzheimer's disease. Every 70 seconds, another American is diagnosed with Alzheimer's.
Welcome back, our viewers. During Scaring today, we speak about Alzheimer with Dr. Mohammed Bardi, psychiatry consultant. Dr. Mohammed, what's your general advice to all our viewers to avoid being a patient of Alzheimer disease, and to all the youth also to preventing themselves from being be affected by Alzheimer?
Yes, of course. I think they should eat healthy. I mean, this is a general advice. They should eat healthy, try to avoid stress as much as they can, exercise your body and your brain.
Yeah.
And if you start to have symptoms, or if your relatives have symptoms, please go and seek help.
Yeah, okay. And what about to be in the safe side from your point of view as a psychiatrist, to be away from depression or anxiety or something like this that be related or something to Alzheimer? How we can be away from depression or anxiety also?
Yes, again, usually, you know, try to, one of the most important things in life, I think, is exercise. So exercising is very important to prevent any organic illness, and as well a psychiatric or mental illness. And then, again, eat healthy, and whenever you know someone, or if you start to develop problems, don't wait and you know, try to fix it yourself. Go seek help. There's no problems or any, you know, I can't find any problem for someone not going to seek help from psychiatrist or neurologist or any medical specialist, because I think it is important to care about ourselves and about our health, and not delay in helping ourselves as quickly as we can.
What level, if it be any person have some actions that you have tell us, okay, some actions like this or this, shouting, be aggressive, be violence, they should be or visit a clinic. From your point of view, what kind of actions that if it appear, okay, you have to visit a clinic to be related to Alzheimer or anxiety or depression, something like this?
I think the most important thing, when a patient should take a step to go and visit, is when the problem is continuous, because we all have, you know, fluctuating moods during our daily lives. We might become one day we are depressed, other day we are, you know, happy and smiling. But when this becomes continuous and persistent, every day he's shouting, every day he's irritable and easily provoked to anger, I think he doesn't have to wait, he has to go now, because it is continuous. For like 1 week, 2 weeks, it's the same, nothing is changing. So it's not the normal fluctuation of mood. But rather, it seems like it's a continuous and persistent problem, and you have to go and seek help. Also, if the level of aggression is severe, for example, if you're shouting every day, you know, it's some people or some families might find it acceptable, but when you start to hit, like, and cause injury to other people, your kids or your wife or whatever, whoever, or in the streets, it means that you're having a problem. You cannot control your anger, you cannot control your acts and your behavior, so you can't wait. You have to go and seek help.
We want a very important advice from you, but quickly, Dr. Mohammed, what is the important message and advice to have a smile in every face, in every person, to every person? How to make them smile?
This is a very tough question, I think, because under the current circumstances and the stressors, people are finding difficulty to smile. But, you know, try as much as you can to smile and be happy.
Okay, in the end of our program, thank you so much, Dr. Mohammed Bardi, psychiatry and consultant. Thank you for being with us today.
Thank you very much.
And to all our viewers, thank you. Until we meet again next Tuesday, inshallah. Thank you. Wassalamu alaikum wa rahmatullahi wa barakatuh. Our viewers will be sharing, as you know, we are a live TV show broadcasted every Tuesday from 4 until 5 p.m. repeated in the Sunday at 11:30 p.m. the next day at 9 a.m. In every episode we have very important topic and we discuss it with our specialists, help us in explaining and finding solution. Today we will speak about very important topic, Alzheimer. I think very important to anyone to know more about the symptoms, how we can be affected by Alzheimer and how we can deal with the persons that have Alzheimer, if they are from our family or not, and how to avoid being a person have Alzheimer disorder. So let's welcome our guest for today, Dr. Mohammed Bardi, psychiatry consultant. Welcome, Dr. Mohammed, and welcome to Sharing Scanning, of course.
Yes, thank you very much. I really do appreciate the invitation for having me here, and I hope I could add some interesting information and fresh and new information about Alzheimer's today.
Inshallah, you will. Dr. Mohammed, at first we want all our viewers to know more about Alzheimer's disease and to make it so simple and easy to understand and get the message.
Yes, of course. I will try to explain about Alzheimer's as much as I can and try to simplify it to our viewers. Of course, Alzheimer is actually, generally speaking, is a type of a dementia. And it usually affects the intellect. It's a progressive impairment of intellect and cognitive function. To simplify it more, it affects the thinking process in the patients, and they have problems in memory, in thinking, and in behavior.
Okay.
Yes, and regarding Alzheimer itself, it was actually first described by a German psychiatrist and neuropathologist. His name was Alois Alzheimer, and so the condition assumed his name. This was back in 1907. He described a 51-year-old female patient for 4.5 years. He followed her up, and he found that she suffers from dementia of Alzheimer's type.
Dr. Mohammed, what about the causes or the symptoms of Alzheimer's disease? What is the action that if it appears in any person, we know that it's have some kind or from Alzheimer?
What are the symptoms you mean, right? Yeah, as I mentioned, it affects mainly the cognitive functions of a person. So the main symptom usually that appears in Alzheimer's or dementia of Alzheimer's type or Alzheimer's disease is usually memory impairment. It is the early symptom that appears in patients, and they usually complain of frequent forgetfulness. Although certain patients might actually try to conceal this or hide this symptom, it is part of a denial that they have it, and sort of a rationalization that they really don't really suffer from any problems. But mainly they do, most of them do actually complain of forgetfulness, and sometimes the family can notice that they have these symptoms of forgetfulness and memory impairment. Of course, there are other symptoms as well, not just the memory impairment. Alzheimer can also affect the comprehension, the attention, and sometimes even the behavior. And so patients with Alzheimer may present with disturbed behavior in forms of being agitated or irritable, sometimes also, expressing extreme of emotions like crying or laughter without appropriate reason. And sometimes they also show, they become inappropriately funny with silly jokes and sarcasm. So there are different types of symptoms of
You mentioned before
Alzheimer's.
that it's a type of Alzheimer. Is Alzheimer have many types or many levels?
No, Alzheimer is only one type, but the underlying, which is the dementia, which is the syndrome caused by Alzheimer's, has different types.
Okay, speak to us.
Yeah, so dementia, what is dementia? Dementia is the underlying syndrome beneath the Alzheimer's, and dementia is actually, it is defined as a progressive impairment in intellect and cognitive function. And it is actually, before I talk about the types, I want to talk more about the clinical criteria. There is a manual in the United States called the DSM manual. It is used to classify and code psychiatric illness. And in that manual, they classified, they defined dementia of any type as a progressive impairment in cognitive function associated with at least one more symptom of cognitive function, which include aphasia. Aphasia is simplified as language disturbance. A person cannot express himself. Or apraxia, which is inability to carry out motor activity despite intact motor function. For example, person cannot stand up or sit well because of this problem. Also disturbance in executive functioning. What I mean by that is that the person with Alzheimer cannot organize or plan his life or his plan his lifestyle. So these are actually the symptoms that can present, but the main symptom, as I mentioned, is memory impairment. Now, if you want to talk about the types of dementia, the most common type is the Alzheimer's disease, which we'll be talking about today. Other types, common types, is vascular dementia due to vascular damage. Other cause of dementia can include substance abuse, for example, alcohol. There's something called alcoholic dementia, which is caused by chronic use of alcohol. Other causes include, which are less frequent, are infections. For example, where there is the HIV virus or the syphilis can cause dementia. And then there are some reversible causes of dementia, which means that can be corrected medically. For example, metabolic abnormalities like hypothyroidism, in which the thyroid hormone is decreased, can cause dementia, as well as deficiency of certain vitamins like vitamin B12 and folate.
Okay, Dr. Mohammed, what about the age that be affected by Alzheimer? Especially we know that it's 50 or 55 or something like this. What is the difference between if it be affected by person in 26, 27 or 30? What is the difference between them, and what is the special age that be affected by Alzheimer?
Yes, Alzheimer is typically a disease of the old age and the aging. It's very rarely below 65, although Alois Alzheimer did describe a syndrome in